I'm Jack Fink, political reporter at CBSN Dallas Fort Worth. Today, I interviewed the Texas Democratic Party Chair, Gilberto Hinojosa, about the state's response to COVID-19 and the upcoming elections. Here's the interview. Chair Hinojosa, thank you so much for joining us. You yesterday criticized Governor Abbott. You believe that he is reopening the economy too soon. Why do you believe that?
Well, there's certain metrics that under the CDC rules had to be met before we started opening up. Including in those metrics is that there would be a downward turn of new cases for a period of 14 days straight. None of that has happened in Texas. In fact, what Mr. Abbott did was he made a decision to open up the economy in Texas on the week that we had the highest number of deaths per day that we've had ever, on the week that we had the highest increase in cases per day ever. So this is something that certainly all the experts have said that you can't rush. I mean, you know, everybody wants the economy to open up. People are needing to work. People don't need to be holed up in their house all day long with their families if they have to feed their families. But at the same time, you know, we've made a lot of sacrifices for the last 2 months in order to try to isolate this virus in a way that we eventually can go back to work. If you rush this thing, if you try to open up the economy too soon, all our sacrifices are for nothing, because we'll go back to a second or third wave and we'll end up having this virus around for a long time. People are going to be getting sick, and it's going to be very difficult to fully open up the economy in the near future. This is a long game. There's some short-term goals that we can meet, but there has to be adequate testing, there has to be adequate targeting, and we have to show in the metrics that it's appropriate for us to be able to open up the economy.
The governor says that the hospitals have not come close to being overrun, and the fact that he pointed out yesterday that the positive tests versus total tests have gone down. So what do you say to that? Do you just not believe the numbers?
Well, it's like he's saying, our hospitals are empty, go out there and get sick so we can fill them up. That's essentially what he's telling the people of the state of Texas. Look, there's no question that this virus is still active in the state of Texas, affecting people and killing people as we speak today. It hasn't gotten any better by any metric that's out there. You can't rush to make a decision, and these decisions are being made, Jack, for political reasons, not because it's in the best interest of the public, but because he wants his numbers, as Mr. Trump wants his numbers, to look better when people get back to work. When you have an economy where your unemployment rate is the highest that it's ever been since the Great Depression, these things don't look good for people like Mr. Abbott or Mr. Trump. And so rather than trying to fix the situation and making sure that this virus is in check, that we've got it contained, they want to make sure that they can get the numbers that they're looking at for political purposes to where they want them to be, rather than to protect the public. That's not right. That's not why we engage in public service. We don't engage in public service in order to be able to help ourselves. We engage in public service to do the public good. And Mr. Abbott needs to get his priorities straight when it comes to that.
Republicans say that Democrats have basically moved the goalposts. First, it was to keep the hospitals from being overrun, and now they keep moving the standard. How do you respond to that?
The goal has never been to keep the hospitals from being overrun. The goal has been to protect the public. You know, the fact that if hospitals are overrun, that does not make us be in a safe situation. Texas is a really large state. It's the second largest state in the country. It's spread all over the place. It's got some of the largest urban areas in the country as well. We have a healthcare system that for right now can handle the disease that is out there. But for us to say that we got to wait till it fills up before we shut down the economy is ludicrous. What we have to do is to follow what the scientists say, what the doctors say, what the medical community is telling us in order to ensure that the public will remain safe and that we don't have another wave. It doesn't do us any good if we open up the economy, people start getting out there, going to bars and going to gyms and so forth, and then we have a resurgence of the virus, another wave, and then people have to shut down all over again. That's not the way it's supposed to work. We can nip this in the bud now if we decide to just do what the scientists are telling us to do instead of what the politicians are saying. The Republicans are playing political ball with the lives of the people of the state of Texas.
But I going back to the standard, I remember that we heard this from Democratic leaders, Clay Jenkins as well, from early on. There was even a whole hashtag about it, flatten the curve. And that was to make sure that the healthcare system and the hospitals were not overrun. So that's what I heard consistently from federal, state, and local leaders. Did I miss something?
Well, yeah, because that's not what flatten the curve means. What flatten the curve means is that you get a handle on the virus, that you make sure that the virus is being controlled, and that you start pushing it towards a downward trend. When the virus is increasing all the time, it the curve. That means that you pull down the cases as much as possible, so that you can ensure that there is not another outbreak and another wave in order that will get more people sick and kill more people. Whether the hospitals are full or not is not the criteria. The hospitals being full is a crisis in and of itself, separate and apart, that we have to deal with. And that is exactly why we're looking at it this perspective. I mean, I don't know who came up with this idea that the issue of whether or not the hospitals are full is a criteria that we need to guide ourselves by. That is not the criteria. The criteria is this virus contained such that the public can go out freely and work and go into public places without the risk of being exposed to this virus and bringing it home and increasing the number of people that are out there. That's the criteria, and that has not been met.
So what is your solution then? And what do you tell workers who want to get back on the job?
Our solution is the solution that is being recommended by the scientists. Increase your testing. Make sure that there's testing available to all over the state of Texas, and in the large urban areas, in the rural areas, in the I just got off the Zoom call last night with folks in the Panhandle, where there's hot spots in the Panhandle where people are dying, are getting sick at rates not even much higher than anywhere else in the state of Texas. Make sure that we're testing and knowing where this virus is at, where it's concentrating at, targeting these areas, isolating these communities, and then opening up gradually the economy in those areas where you feel satisfied that the virus is under control, it's being checked, and it's on a downward trend. That's what the scientists say. That's not what the politicians say. That's what the scientists say. That's all we're asking our government leaders to do.
How long do you anticipate that taking?
You know, I'm not sure. I mean, it could take maybe another month for us to get to a point where we're ready to start looking at different parts of the economy to open up. You can't do it too fast. Look what's happening in China. You know, they opened up, and we're having another resurgence of the virus in China as well. So we can't be in that situation. When the scientists, and I think that if we continue the social distancing, if we continue masking up, if we continue making sure that we're testing as many people as possible, the numbers that are of people that need to be tested, the scientists have already told us what they are. Let's get to those numbers. Let's isolate this virus. Let's make sure that we're targeting and preventing other people from getting close to people that have this virus. Once we get that in hand, then we can start opening up the economy. But Mr. Abbott is not following any criteria. He's just saying, we're going to open it up. That's it, because that's what I want to do, because my numbers look really, really bad. And that's what Mr. Trump is saying. And that's not what the scientists believe is the solution to our problem.